Hi, I'm Dr. Michiyuki Kono. I'm an orthopedic hand surgeon with Kaiser Permanente in Orange County, California. Today we'll be doing a procedure on a condition known as Dupuytren's disease. Dupuytren's disease is a genetic condition seen in Caucasians, typically of Northern European descent. And in this condition, patients get lumps and bands within their hand that causes the fingers to contract down, preventing them from opening the hand and fully straightening the fingers. In terms of treatment, there are several options, but one of the more common procedures we do for milder cases is what's called a needle aponeurotomy. In this procedure, under a local anesthetic, I'll use a needle to cut the bands which have developed in the hand to allow the finger to fully straighten. So as you can see here, the hand has these bands along the ring finger and small finger, and they prevent the finger from fully straightening out. So you can see here, give us a maximal extension, and you can see that the finger won't extend fully, and as a result, the hand cannot go flat on the table. That's because of these bands which have developed. These bands are not the tendons. A lot of times people think that these are the tendons sticking up. In fact, these are the bands that we see in Dupuytren's disease. It's a thickening of what we call the palmar fascia. It's the tough gristle layer that's on the palm of your hand. You also see it on the bottom of your feet, and it provides durability to the hand so that the skin doesn't move around and can withstand shear forces. If you look at the back of the hand, the skin is nice and loose. You can actually lift the skin up, and that's good for mobility, but it's not very durable. On the working surface of your hand, where you're going to be putting tools or instruments, or as in baseball players where you're going to be holding a bat, the skin needs to be much more durable, and because of that you have a tough, thick layer underneath called the palmar fascia. That palmar fascia has some cells in it called the myofibroblasts, and in this condition those myofibroblasts start to grow abnormally and form these thick bands that are made primarily of collagen. As these bands thicken up, they'll tighten and prevent the fingers from straightening. So our plan for today is to do a small office procedure under a local anesthetic where I'll take a needle and poke holes and sweep along these bands, cutting them, allowing the fingers to straighten out. It does not get rid of the band, it merely cuts them and allows the fingers to straighten. So what I'm going to do next is I'm going to go ahead and numb up the hand. So just doing a little sterile prep, and then I use ethyl chloride as a topical anesthetic to freeze the skin, and that takes a little bit of the sting out of the shot. And just with a little bit of local anesthetic, you'll feel a little pinch here. Now I don't need to go deep. The band itself does not contain any nerve fibers, so as I cut the band, there won't be any pain. It's only the skin. So we've done the ring finger. Now I'll do the small finger. Again, same thing. Quick pinch here. Starting to feel numb in your palm? Okay. Do you still feel me touching on the fingers? Okay, so the sensation of the fingers is still intact, but he's numbed up in the skin. All right, now I'm just going to sterilize his hand a bit, do a little bit of a surgical prep. Does it feel numb in your hand as I scrub it? All right, put your hand up. Nope, turn your palm down. Feeling numb along the top of the, or the palm of your hand there?
Yeah, it's going up into the finger a little bit.
It is going up. You can feel me touching you here?
Mm-hmm.
Okay. So the tight band along in here, we'll start with the ring finger. You can actually see the band sticking up. And so I'll take my needle here. Feeling anything?
Mm-hmm.
So he's numb. You can sometimes even hear a little bit of that crunching as I pop. And as you can tell, as I release, you can see how the finger's already going a little bit straighter. Do you feel that? So you can see now the ring finger already goes almost all the way straight. Make a fist for me. All right, and open your hand up. Good. So just by poking with the needle and sweeping, you could hear the crunchiness as I release the band. This finger now goes fairly straight. Now let's work on the ring finger a little bit. Go and get a fresh needle. So the tip of the needle has a point to it, and as I sweep along here, I'm poking holes in the band and sweeping back and forth with the tip, and the tip is sharp enough to cut the band. So you can kind of see the needle even bending a little bit as I sweep. I can actually hear it crunching as it releases. You can probably feel it as well, right?
Yeah.
Wiggle your finger. Okay. So sometimes we'll check with wiggling just to make sure that the tip of the needle is not hitting a tendon. One of the risks, of course, is that you can accidentally cut a tendon if you go too deep. So periodically, I'll have him wiggle the finger just to make sure that the needle doesn't move. That way I know I'm not in the tendon. You can see he's already got a fair amount of correction here. Go a little bit more. So you can see already now he can open his hand a lot more than what he could before. There's still a little bit of tightness right in here. And sometimes as I really stretch it, I'll feel the last few strands pop a little bit. I can still feel a little bit of a tight band right in here. One of the things about this procedure is that you'll notice there are lumps in the hand, and this procedure does not get rid of the lumps. It merely takes the tightness of the band and releases it so the finger can go straight. But any lumps in the hand will still remain. The only way to get rid of that would be to do the old-fashioned surgery, where we actually cut open the hand and take the tissue out. All right, so even at this point, open your hand up. You got it almost all the way flat. Again, you can still see a little dimpling and you can still see the lumps there. Again, this procedure doesn't get rid of that, but it did cut loose these tight bands. All right. So just at rest, it looks straight. Now really stretch your finger out, open it up. Good. And you can see it's pretty much, oh, you can feel that last little bit tear there. Good. Good, open your hand up. Good. Now you can see the fingers are straight. Make a fist for me. Open them up. Good. All right, so a little bit of lumpiness. Let me just see if I can feel a little more. Don't really feel any more tight band in there. Good. So give a little bit of a stretch. Sometimes there are a few little fibers that are still intact. And so by stretching, and I can actually hyperextend the finger backwards now. Feel a little bit of a pop as I release the last few weakened fibers. Okay. Open the hand up. Good. So now, hand opens up. And with the hand on the table, you can see the back of the fingers touch the ground, which they didn't before. Put the hand flat, and now the hand goes flat. Okay. And if we look sideways, fingers are parallel. All right. Make a fist for me, and open the hand up. Good. So the finger's still moving well. And as opposed to doing a surgery where we actually cut everything open and take it out, there's no incision, there's no wound to heal. You can start washing it right away. The only thing we avoid is any golfing or any other type of direct impact activity on the palm for about 3 to 4 weeks. But in terms of other activities, you can start going back to doing activities pretty much right off the bat. All we do is put a little Band-Aid on there, wrap up the hand. And then just encourage stretching right off the bat. If you're unable to fully straighten it on your own, sometimes we'll put a splint on there. But as long as you're able to get it all the way straight on your own, we don't put a splint on, and we actually have you moving it right off the bat. Okay. How's that? Night splint just out of plasters that you wrap on, but sometimes it's a little bit uncomfortable, so I don't do it if you don't need to, and just make sure you stretch it. It's just a matter of stretching it out.
Yeah,